Nō reira, without further ado, our next kai kōrero, Johanna Rhodes from the Southern Institute of Technology. Presentation title, A Sense of Belonging, the Implementation of a Student-Led Mentorship Program. Johanna is the head of School of Nursing at the Southern Institute of Technology. She believes that a balance between the art and science of nursing care is essential in this tempestuous period of change. She attributes her teaching pedagogy as reflecting the real world as being critical to developing work-ready graduates who are equipped to work in the electrifying, intricate and fluctuating world of healthcare. Ka tika. The use of simulation modalities in her teaching offers a willingness to advance the narrative of healthcare while embracing the realism of working with people. She is inventive and seeks opportunities to advance her management, teaching and research while maintaining focused strategies to create interesting, realistic and engaging learning opportunities. Nō reira, e te iwi, Johanna Rhodes.
Kia ora koutou, hara mai. Hello everybody and welcome to our presentation, A Sense of Belonging, the implementation of a student-led mentorship program. My name is Johanna Rhodes and I'm the head of school at the Southern Institute of Technology, and my colleague Mary McMillan, who is a nursing educator at the same institution. Do you remember when you began your nursing education? For some of you, this may have been at a university, a polytech, or even in a hospital. But do you remember that first day? Did you feel like you belonged? And what happened in the weeks afterwards? A sense of belonging? Maybe, maybe not. The beginning of last year, 5 very inspirational Year 3 nursing students came to me and said, "Jo, we would like to do a student-led mentorship program." Why do we want to do this? Because when we were in Year 1, we remember the Year 3 and Year 2 helping us. They helped us find a classroom. They told us what was nice at the cafe. They told us which teachers to watch out for. We valued that and want to be able to share it in a more formal way with new nursing students. I'd just become the head of school at the time and thought, why not? From a fiscal point of view, it was going to cost the Institute no money. So I welcomed it and said, let's do this, to use a quote from the Labour government. So the program began.
So we did some research at the end of the first year of the implementation of the program, and certainly the purpose of the program was to foster better communication and community within the School of Nursing across Year 1, 2 and 3. Also to hopefully reduce stress and also foster that really important sense of belonging within the School of Nursing. The second purpose was to offer a mentorship program that gave the leaders the opportunity to learn those really intangible soft skills that are so important to nursing, like communicating and relating, and also onwards into leadership and showing leadership and being able to provide that. So we pondered about it and thought, probably need to do some research. So at the end of the first year, we thought, let's think about this. What kind of research might start to be able to show some of the possible benefits and risks related to having a mentorship program within a School of Nursing. So the aim of the research was a qualitative study to evaluate the inaugural student mentorship program in our School of Nursing. So after we decided what the aim of the research was, we considered design, and we decided that narrative inquiry was the way to pursue this. We did use an electronic platform that is already used in the Southern Institute of Technology for educational purposes, and that is Blackboard. So the questionnaires, or the 2 questions, were placed within that Blackboard platform, which meant they were readily available to all the students that had participated in the mentorship program. So analysis was important in how we were going to do that. Because it was very much a fluid situation and the first time it was happening, we decided that the narrative, the telling of the stories was really important. And the framework that was used to look at the material that was coming in was called restoring, or the telling of those stories through the research. So overall, when Jo was doing the analysis of the materials, she found that there were some stories that were very much about positive experiences from both the mentees, those that were mentored, the mentorship leadership group, and also the other third-year students who were mentors alongside the leadership group. And the things that they described were from the mentors and mentees, leaders and those who worked with the leaders, was positive experiences with reduced anxiety, and certainly that is where the theme of this talk comes from, a sense of belonging. And also increase in those skills, especially those intangible skills, or soft skills as they're called, but we like to call them hard skills. In nursing, we think relating and communication are actually the basic skills that student nurses need to have. But also problem solving and leadership were important. I'm just going to let Jo take over and actually let you hear the voices of the students and the mentors as recorded for the research. And you'll note on the poster that there's also some direct quotes from the different groups as well.
Okay, so 188 students participated in the program and were all invited to complete the survey that Mary has described. 82%, a total of 154, responded. So it was a really good response rate, and we feel has really valid data that has supported the continuation of the program. But it's not our voice you need to hear, it is the students.
I really enjoyed that this year when we were off campus and out on placement at the hospital, when I saw the year 2 and 3 students in the cafeteria. They were mingling with one another and seeing how each other was going and encouraging each other. And so to see that continued community, not just on campus but off campus as well, was really rewarding.
Helping and supporting the art of nursing.
Through the peer mentorship program, I've been able to get to know and encourage the year 1 and year 2 nursing students, which without it, I wouldn't have been able to build those new relationships.
This year we have developed or organised multiple different social events, which has brought together the BN, EN and SCP students. I feel like it has developed a sense of community and broken down barriers within the school.
Incredibly rewarding to watch a group of students, a whole school in fact, 250 students come together and share kai over a lunchtime. A really rewarding experience watching the breaking down of silos between the groups. No longer did we have year 1s gravitating to year 1s, year 2s, etc. They were all gravitating together because they were hanging out with their mentor. Really rewarding to watch.
So I think one of the greatest things that the peer mentorship program kind of did for the year of nursing this year was they hosted a lot of social events, which kind of brought ENs, year 1s, year 2s and year 3s all together, gave us a bit of time to talk to one another, understand some of each other's experiences, and definitely just drew us in together as a nursing community.
Being a nurse mentor in year 3 nursing has really made me feel a more whole part of the nursing team from year 1 to year 3.
The art of nursing, engagement and communication.
I really enjoyed the peer mentorship. It was really good talking to someone who knew what was coming and everything. It was really good when exams, like what I should be focusing on, especially with certain teachers. It was really good. And if you just needed a question, you just like text her and say, "Can I meet up?" And it was good.
Okay, I really enjoyed the mentorship program. It definitely helped me with my nerves first year. Like going into it, I was like, it's gonna be horrible. I don't know how to take the first assessments and things. But talking to my mentor, she just told me what books are best to buy, what to do, and ideas. And she basically taught me cultural safety before I learned it and stuff. So I really enjoyed being mentored.
And as we're aware, cultural safety is one of the hardest concepts for nursing students to understand, and it was a accidental finding of this study that many students expressed that they understood cultural safety better through having been involved with our year 2s and year 3s. So it was a powerful finding and worthy of future research.
What I enjoyed about the peer mentorship program was I guess for me it got me out of my shell. I'm someone who's kind of shy, and having to help other people through year 1, which I had been through, was quite good and helped me even have better communication skills. And even though I was in touch with my mentee who I was paired up with, but I did end up working more with someone who I wasn't paired up with, who had tips of questions, and I was there to help them in their journey through year 1. Yeah.
And that was quite a significant finding in that some students started off fully engaged with their mentee, and then slowly their mentee made friends and they found their role took a back step. But what was very strong in the results was the mentee saying, but I still knew they were there and I could still contact them if I felt I needed to.
Out of the peer mentorship program, because I really felt that community of nursing come together, and I got to meet lots of lovely people, and it was really nice.
And finally,
I've found this year, while it's been really awesome being able to connect with other students, that personally for myself, I feel like my leadership skills have developed hugely and my problem solving abilities have increased just through being a leader in the program.
I gently ask you all, what is the most important thing in this world?
Hei tangata, hei tangata, hei tangata.
It is the people. It is the people. It is the people.
So this peer mentorship program is kind of like being able to bring all 3 year levels together. So in the past it's kind of been just the year 1s, just the year 2s, just the year 3s, but now it's just kind of like, feels like we might like a now big combined kind of like community group, and it's just been really excited to kind of get to know everyone throughout it and just feel connected.
We're really grateful that you've all come today to share with us a program that was implemented, driven by students, for students, recognising the art of nursing in conjunction with the science of nursing, understanding those soft skills or those intangible skills that are often not spoken and arguably difficult to teach. It happened with this program. What we welcome is future collaboration. We're very happy to share our resources because we believe this program could be bigger, and that we could have a mentorship program between new RNs and year 3 nursing students. There's more research to be done, and we would welcome your collaboration with us to do that. Kia ora. Thank you.
Kia ora, thank you.
Anō reira, tēnei te mihi atu kia kōrua Johanna Marie. Mō ngā kōrero kua tukuna nei a kia tātou tēnei ahiahi. So after listening to your kōrero, a whakatauki comes to mind. Hea tāhua te noho tahi o ngā tuakana me ngā taina I runga I te whakaaro kotahi. And so that just talks about the older and the younger students coming together in the one thought to help each other out. And then the last kōrero I have to say is mā te tuakana e whakatika te taina, but the older student's job is to correct the younger student Mā te teina, e whakatika te tuakana, and the younger student will keep the older student honest. So I mihi to you both today with the kaupapa that you've brought to our conference. There is one question coming from the Q&A at the moment from Whaia Iseta, and that is, thank you for your presentation. Just wondering on the ethnic breakdown of the students and like to know who else was involved in the design of the research. How culturally appropriate was the research methods?
Kia ora, thank you for your question. Essentially, all students were able to join our mentorship program. We didn't actually ask in the research for their ethnicities. However, that would be something that would warrant further research moving forward with this program. It was ethically approved by the SIT Human Ethics Committee. We acknowledge diversity around cultural difference, and indeed you would have seen we've had some of those students that were talking were some of our international students and some of our domestic students also. So in this particular research, it wasn't a focus of the research, but fully acknowledge that future research going forward, that would be the next sort of arm of the tentacle, if you like.
Kia ora.
Yeah, kia ora. We were very mindful of our bicultural and multiculturalism within our cohort of students and also international students. And certainly there was some outstanding work from the Year 3 cohort to ensure that peoples from wherever they were, but particularly Māori, were able to access senior students that, of course, are from their iwi or from where they come from in the world, so that they could feel comfortable and happy with the mentorship program, and also talk about the struggles that are particular and the positive things that are particular to them.
Nō reira, e mihi ana kia kōrua. Thank you very, very much for your amazing kōrero this afternoon. Just like to finish off with what you both said in the kōrero. Hutia te rito o te harakeke kai he te komaku e ko. Ki mai koe kia hau, heha te me nui o te ao. Māku e ki atu, he tangata, he tangata, he tangata. Tēnā kōrua, mai te ngā kauwiti rawa, ko tauraurau, ko takuraurau, ka ora tātou. With your kete and my kete, we will survive. Thank you very, very much for your time. Mauri ora, kia kōrua.
Kia ora, thank you.
Hei
Kia ora.